Okay, here's the second part of the fungal kingdom series. We're going to talk about mold. Previously, I was talking about yeast, so you can go back and look at that. And if my video gets cut off, you can watch it at gijanelle.com. They're all there, all the full links. Okay, so I talked about yeast. We talked about how yeast is a single cell organism. Mold is a multicellular organism. There was a long time where we thought that mold couldn't grow in the body. But here's what I found. Well, first of all, we know from the Mayo Clinic study that 95% or more of chronic sinusitis overgrowths are actually a mold overgrowth, and that's from culture, which was a brilliant idea to culture what's in the sinuses. Because, you know, if you've got a sinus infection or chronic sinus problems and you think it's bacterial and you keep on hitting it with antibiotics, you're obviously going to make the mold worse. Steroids is another big treatment for that, and yeah, that can actually make mold worse as well, but it can alleviate your symptoms, at least temporarily, as an anti-inflammatory. But I digress. So what I want to talk about is mold in the digestive system. There was a study that I came across, I'll link it, and that study showed that mold spores can be ingested as part of our food, right? They can be in our food. They can be ingested, and they can actually stay in mold spore form, which is a very resilient form, until your body becomes immunocompromised, and then they can take over and disseminate. So it's not unheard of for someone to have mold in the digestive system. So that's different than yeast, right? Because yeast requires a different medication in order to get rid of it. So if you're trying to get rid of mold in the digestive system because you suspect it's there, maybe you've done microbial organic acid test, and that's an indirect measurement, or there's a serum antibody test for mycotoxins, which will tell you, alert you to the presence of mold in the body. I like both of those tests because it's a really hard thing to determine once you've gone through your 8 weeks of the full GI Janelle 1 powder. If you're still having fermentation symptoms, then it might be yeast, it might be mold that just is too strong to be impacted by this natural treatment. So if you still have fermentation symptoms, gas and bloating, that's when I'm going to go in and I'm going to look for other reasons for it, and that's going to be in the department of yeast or mold, not bacteria. Most of the people I see have had tons of rifaximin, tons of Xifaxan. They don't need another antibiotic. If it hasn't worked, if it didn't work the first time, why would you do it again? It's kind of makes, it's a head scratcher. So I'm going to go and look for some kind of other fermentation species in the fungal kingdom, either yeast or mold. If we determine that mold is the problem, then there's really only 2 choices, and these are long-term treatments, right? Don't expect to get any better until you've been on them for at least 3 months. With mold, you need to use either itraconazole or voriconazole. Those are the 2 medications that treat mold. You have to make sure that the liver is okay before initiating these, because they're a challenge for the liver to process. And if you're going to be using them on an ongoing basis, say you're going to use them for at least 3 months in the beginning, check the liver first, check the liver at intervals, make sure that you're doing this in a safe way for the patient. So if you look at part 1 of this, you're going to see fungal treatments. If you look at part 2 of this, which is this, I'm talking about mold treatments. And that's one of the things I need to do in a small percentage of people once they finish their GI Janelle 1 treatment, because they still have resilient organisms living inside of them that aren't going anywhere unless you use a strong medication. I hope this helps.